Okay. Yeah. Jeez Louise.
I know.
Hey, Mike, this is Emma.
Now at 6, frontline workers lining up for shots.
I'm worried about my staff getting ill.
But some providers feeling left behind.
What about us? We kind of feel like there's not really a plan for us.
News 4 asking why those outside of hospitals aren't getting help.
I'm tracking light snow, perhaps our first measurable snow of the season. I'll get you ready for it with an update on the timing and amounts.
The new need? COVID-19 detectives.
It would have to be someone that can really pay attention to detail.
Cheers! Cocktails to go. They may be staying around for the long haul.
Live from the KMOV Broadcast Center in downtown St. Louis. This is News 4, watching out for you.
Now at 6, snowflakes flying. The forewarned storm team is tracking what may be the first measurable snow to hit the St. Louis area this season. Thanks for joining us tonight. I'm Corey Stark.
I'm Samantha Jones. First the cold blew in, now that light snow's on the way.
And Chief Meteorologist Steve Templeton is timing when the heaviest of it will start coming down. Hey, Steve.
Hey, yeah, well, Corey, this is not going to be a big storm. That's what you need to know, and it's not going to impact anyone this evening. But some light snow and perhaps our first measurable of the season on the way tonight into tomorrow. What you see right now on Sky Tracker Doppler radar, not reaching the ground. It's hitting really dry air, so it doesn't reach the ground. But there's been snow coming down in Oklahoma and Kansas, and as that sweeps through later tonight and into early tomorrow morning, mainly pre-dawn hours, that's where we could see our first measurable snow. I'm not expecting much dusting to maybe some spots get as much as an inch. So again, not a big storm and nothing falling from the sky right now, but boy, it's cloudy right now as we look from the BJC Skycam network from St. Louis Children's Hospital, Steinberg Rink there. It'd be nice if there were a few flurries to set the ambiance for them, but it's all dry out there right now, and that's good news if you have travel plans this evening. Just cold, cloudy, temperatures in the low 30s. We might start to see some flurries by maybe 10 o'clock, but especially after midnight, we'll see this light snow push through, and I'll map that out for you. We'll time it out hour by hour in the Super Predictor coming up.
We know healthcare workers are the first to get the coronavirus vaccine, but some frontline workers outside of hospitals are being left in the lurch.
They don't know when they can get or give the shots. And News 4's Emma Hogue is live from Total Access Urgent Care in South City. Emma, you just got some answers from Missouri's health department.
Corey, and at this point, they're telling me there's only so much vaccine to go around. Right now, the state is working to ensure doctors who work outside of a hospital setting can get the vaccine this month or next. But tonight, these employees, these doctors want a clearer timeline on when that will be.
My team is constantly exposed to this.
Since March, Total Access Urgent Cares have served as one of the St. Louis Metro's primary COVID-19 testing hubs. But President and Chief Medical Officer Dr. Troy Dinkle says his team is eager to start administering the vaccine.
We're in the process right now of applying, but obviously no guarantees can be given, but we are checking daily and making progress on procuring the vaccines.
Nearly 600 Total Access staff members across 26 locations confirm about 500 positive COVID tests a day. Dinkle says he's waiting to hear when his staff can get the vaccine and start administering it.
Yes, I am eagerly and regularly working with the state, and we reach out at least once a day to move this forward.
I'm worried about my staff getting ill. We do have comorbid conditions.
Yet physicians at other urgent cares and smaller private practices like Vo Medical Clinic wonder how soon they can get the vaccine. Dr. Mimi Vo says she can't get a hold of state and local health departments.
I emailed and called. I spent actually 2 hours on the phone last Friday and kept being rerouted to the COVID hotline.
But News 4 was able to get a hold of Missouri's health department. They tell us physicians, assistant physicians, and registered nurses can prescribe and administer the vaccine right now in phase 1. But first, potential vaccinators must apply, fill out several documents, a distribution plan, and watch a training video. The state health department then reviews enrollments 2 times a week.
We kind of feel like there's not really a plan for us.
As for these physicians, the state says a limited supply is preventing some doctors from getting vaccinated right now. To be effective and efficient, they're focusing on sites like hospitals that allow them to distribute in bulk.
This is a highly infectious virus, and the vaccine is a great glimmer of hope.
The state says as they get more vaccine, they will notify these other doctors who haven't been vaccinated yet and ensure that they are made a priority. But again, still no word on exactly when that will be. Count on us to keep digging for details. We'll let you know when we get new information. But for now, reporting live in South City, Emma Hogue, News 4.
Emma, thank you. News 4 reached out to the Illinois Department of Health and learned their distribution priorities. First, the vaccines go to hospitals, then local health districts and federally qualified health centers and other providers. As vaccines become available, the state will increase the types of locations where people can be vaccinated.
If you take a look at this, BJC is unboxing its vaccine shipment tonight. The hospital system starts giving workers doses on Thursday. Right now, the Mercy Hospital Group is monitoring its employees after vaccinating them yesterday. And News 4's Russell Kinsall checks in with the first person in St. Louis to roll up her sleeve.
Applause and cheers erupted after Dr. Amina Akhtar got the first COVID-19 vaccine in St. Louis.
My left arm. It's been almost 24 hours.
Dr. Akhtar is an infectious disease specialist and the chief medical officer at Mercy Hospital South. She was one of the 20 hospital workers to get the vaccination first. A day after her shot, she said she only feels a little soreness. But the biggest side effect, she says, is the emotional boost it's given healthcare workers.
It gives you an amazing sense of empowerment and joy at the same time. You know, you've taken a small control over this situation.
Akhtar says the vaccine will help nurses and doctors stay healthy and on the job and avoid the potential for critical shortages of frontline workers.
Because of the higher incidence of COVID in the community, is that our own healthcare workers are getting infected and calling in sick. And so not only are our healthcare workers protected, they can continue to take care of their patients.
When anyone gets the vaccine, they'll be given a card that verifies they got the first and later the second shot. She says someday it could be more than just a souvenir.
And I suspect we'll maybe need to demonstrate our vaccination status sometime in the future as we travel or as, we move around, and it'll be of great usefulness in that regards too.
Akhtar said of the first to get the vaccines at her hospital Monday, none experienced any side effects other than soreness. Russell Kinsall, News 4.
We've been following CVS going on a hiring spree to handle vaccines. Illinois-based Walgreens is also hiring thousands. Right now, they're looking at filling 25,000 positions like nurses and pharmacists. They'll largely be responsible for administering vaccines, and Walgreens' big focus will be helping struggling communities.
You know, one of the things that's become very obvious throughout the COVID pandemic is the intensity or the pressure that has been put on underserved areas. So it is our intention to lean into those places so that we can get the vaccine to the people who need them most.
We also asked Dr. Ban how Walgreens will carry out their plan in those areas. He says right now they're planning mobile clinics so they can get people to and get them to people and be more accessible.
Contact tracers are critical when it comes to tracking the spread of COVID-19. News 4 has been finding messages on social media about training for the job. And the question, are they legit? Some promise she'll make $22 an hour or more. Well, new at 6, News 4's Ray Preston explains what he found out about these job postings.
For me, education is valued.
Nishi Parkinson has been in healthcare for more than 20 years. So far, more than 1 million people have enrolled in a 7-hour online contact tracing course offered by Johns Hopkins University. Parkinson is one of them.
It was easy to move through, but you had to be really detail oriented.
Last month, St. Louis County announced it would no longer be providing contact tracing. The number of patients had become too overwhelming. We're told that different people use the Johns Hopkins course in different ways.
Some people have just taken it to understand what contact tracing is and confirm that they're interested in a job doing that, and then have contacted the local health department. Some folks have just been hired by health departments, and then they've used the course as a part of, their introductory training materials.
There is growing concern among healthcare workers that people inside for the winter months will only give the virus more opportunity to spread. And contact tracing has also given scammers the opportunity to try to get personal information.
Contact tracers will identify themselves. So if you are contacted by somebody who is not providing you ample information, that's a red flag and you need to just hang up.
We asked Parkinson what kind of person would be suited to be a contact tracer.
It would have to be someone that can really pay attention to detail. You have someone else's life in your hand.
Dr. Gurley says she doesn't know of any place around the country that's done a good job of containing the spread of COVID-19 that doesn't have a good contact tracing program. In St. Louis, Ray Preston, News 4.